Well, good morning to all, and thank you for being with us this morning from A Faith That Does Justice. I'm Peter Giles, the director and founder of A Faith That Does Justice. And I first want to just acknowledge that yesterday we did have some glitches in this streaming. It's the first time we're doing it, and I think we're on track today. Those who tried to get to us yesterday, we hope you're with us today. But the intent here today is really to try and offer a message of hope. We are in the midst of some difficult times. With this pandemic, the coronavirus pandemic. However, in this time of uncertainty, we really want to talk about the faith that we have and what really A Faith That Does Justice talks about. We speak first and foremost about a faith that does justice as being really an adult way of living faith. And by what I mean by that is really what we're talking about is living faith in action. Now, ironically, you may say, here we are staying at home, social distancing, and how are we living faith in action? And I think, quite frankly, we can. And that's what I'd like to talk about. I'd like to offer a couple of observations first, and then really you have a chat box on probably the right of your screen. And if while I'm talking, you have a question that comes up or an observation, please feel free to share it. After I finish talking, I'll look to see if we have any questions or observations and maybe try to comment on a couple of them and then go from there. So let me begin. We do live right now in unprecedented times. In the past several weeks, we've been asked to stay at home. We've been asked to social distance. We've been asked to be very careful about being out and around without masks now. And so it really has impinged on a lifestyle that most of us are used to, of being very free, very open, and very mobile. And yet there is great uncertainty, there is great fear within the community, and it is justified. We know of people who are working on the front lines, physicians and nurses and other hospital personnel who are essential workers, who are in the hospitals dealing with people who are infected and probably wondering themselves, I hope I don't get infected, but what if? What if? On the other hand, there are people who have been laid off from work who need salaries to be able to run their households, wondering what if and how are things going to change and when will they change? On the other hand, there are people probably with chronic medical conditions who really are wondering to themselves, I can't see my doctor, I can't go to the hospital, I can't go to the office, and I do have needs myself. And all of these are being deferred for the most part until we can get over this current crisis. And finally, maybe even more mundane, many of us have to go out at some point to go to the store, to buy milk, to buy bread, to buy essentials foods within our homes. And even there, we wonder, who am I next to? Who am I coming upon? And wondering, I hope I don't get infected. So with that in mind, I think that really A Faith That Does Justice offers us the opportunity to live our faith. And by that, what I mean, I'm going to take the faith aspect of it first, and then the action component second. From a faith perspective, we believe in a God who is active in history, a God who did not create the world and walk away and has no interest in what is going on. We do not believe God created this pandemic. The deaths, the morbidity that we are seeing right now is human-made. We've been told that if we stay at home and avoid this virus, we will be okay. Surprisingly, or perhaps even gratefully, many, many people in this country are complying. So this God who we believe in is active. This God is with us in good times and bad times. This God is with us at this time. Ironically, we enter into this time of a special week for both Jews and Christians. The Jewish people began their Passover celebration yesterday evening. It is a time for them to remember that the God of Israel took them from Egypt and brought them back to the land of their fathers so that they might live as God intended them to live and to be God's chosen people and a light to this world, showing people how God really intends us to live as human beings. And from the Christian tradition, we are really at the end of Lent and really within 3 days of Easter. We enter into our sacred Triduum. Tonight is Holy Thursday, the celebration of the Eucharist, the celebration of the mandate to love as one another as God has asked us to do, a special time of year. So we cherish our faith at this time. And faith can be lived beyond the temple, the church, and the mosque. That's another tenet of what we really talk about. The faith that we believe in is not confined to the liturgical practice within a temple, within a church, within a mosque. It's really a place we can go, which we lament right now that we can't do, but a place to be nourished among fellow believers, but really with the call to move beyond the church, the temple, and the mosque, to be available to people, to live the mandate of love among all God's people, and to be for others what we really need and hope for ourselves, a source of God's love that we can cherish and to spread to this world throughout. So we live this faith, and with it, we pray. We can also pray from our homes, and there's reason to pray. We can pray for the public health officials who have really created these models, created this advice, telling us to stay at home. We all hear about the curves and how we need to level the curve. And what we are being told now is that social distancing is working. So we pray for these people who have the insight, the epidemiologists who are following these diseases and can really advise us how we can do our part to really help to hasten the end of the epidemic so that we can return our lives to some sense of normalcy. We also pray for those who are in the hospitals, working among the people who are infected, praying that God will spare them of this disease. God will nurture them and help them during this time of crisis. And we pray too for those who are infected. We've been told that as many as half the people in this country who are infected are asymptomatic. There are many, many people with this disease who do not show signs and symptoms. Also encouraging us to really be careful about being around people. And finally, we pray for families who have lost people to the coronavirus, families who know somebody. We are all affected. The longer this will go on, the more likely it is that we will all know somebody who has been affected. So we pray for all of these people, that they can be consoled, that the God we believe in is with them in good times and bad, and that right now this God is walking with us, encouraging us, offering us hope, that if we do what we are being told by the epidemiologists, that we can do our part to hasten the death toll, to hasten the morbidity that might come from this disease. The other half of this equation is, how can we act? And some may say, well, we're home. We can't do anything now. We can't be in society. But there are things we can do. The first thing I would say is that we should leave nobody alone. We have the means through telephone, through social media, to be in touch with people. If you know people who are alone in their own homes, we can care for each other. We can reach out to them through social media, through our telephones, asking, inquiring, how are you doing? If there are problems, we can intercede through the authorities by getting them help if they need it. That's really a crucial part of this. And it is acting our faith, living out our faith in action, even though we are in our homes and can't be in close proximity to the people who may need help, may need encouragement, may need a sign of hope. We can spread our faith, our belief in a God that is with us, walking with us, and that is offering us hope in this time of crisis. We can share that with other people. The other thing we can do is to continue the measures we've been asked to keep, of stay in place, stay at home, social distancing, frequent hand washing. These are all crucial to getting over this epidemic and moving on to a sense of normalcy. So those are things we can do. Finally, what I'd like to talk about too is really this current mechanism. We are grateful to people in Boston who have supported the program we have begun here. We're grateful for people outside of Boston who really take advantage of the meetings we have through social streaming that we have, the media, social media. And we're grateful. We're grateful for people who come to our meetings, our community meetings, our workshops, which really talk about living faith in action and really making ourselves aware of the social issues of injustice that exist within this world that we can do something about. We also have our ESOL program, English for Speakers of Other Languages. And because of people like you who have helped us through volunteering, through donations, we are now able to put that online. So our people in need of language skills this week have gone online to continue that program. Gratitude to you for helping us to make this possible. The people who offer their time, their talent, and their treasure, we are also incredibly grateful. Whether you're in Boston or outside of Boston, we know there are people following from different areas of the country, and we welcome you to come on this journey with us as we seek to deepen our relationship with God and to live our faith in action on behalf of all God's people. So with that, I'd like to stop and to really see if anyone has written in anything. And I'm going to look, I have to move up closer to my camera here, but I'm hearing, what recommendations do you have for people who feel despair and the real threat of losing jobs and wonder how our faith can help us in this regard? Well, I think I've touched on that to some extent. I think that we really have an opportunity to offer hope to people by being in touch with them through social media, be that telephone or other mechanisms, to really encourage people to not give up hope, to rely on a God who we believe does not walk away in these kinds of times, but this God who is with us in solidarity with the hardships. And from a Christian tradition, I would just say we are about to celebrate Easter. We believe that God raised Jesus from the dead because of how he had lived, teaching us what it means to be a human being in this world that doesn't always accept the values he lived by, of love for all God's people, of compassion for people who are suffering, and with a sense of justice, that God desires fairness for all God's people. We can offer this to people through our ability to be in touch with them and to encourage them to live their faith, to deepen their own relationship with God, to be dependent upon God, to rely upon God. I hear another one here that says the COVID-19 is especially damaging to vulnerable people. How can we help them? That's a great question. We've just heard on the news, I think yesterday they really came out now, there are more statistics where people of color are not surprisingly being affected by this COVID-19 much more than others. It's not a genetic predisposition, likely, it's more the social conditions. This kind of a disease is going to affect people who have health conditions, hypertension, diabetes, heart conditions. And in people of color, poorer people socioeconomically, it is more likely that these people have these conditions that are not well cared for. So not surprisingly, like the HIV virus, the COVID virus is going to attack these people somewhat preferentially. What we can do as best we can from home is what I've already mentioned, of reaching out to people that we know. Whether there are solidarity groups, we can search the internet, and if there are things we can do through that, we would encourage people to do that, to live faith in action as best we can. I see another one here that says, how can we help people in need inside our homes? I think I've touched on that, and here we have one that's really talking about sheltering in place and how important it is. This, I know, is coming from somebody on the West Coast, and the two coasts have been hit the hardest by this, and we really do encourage people to take seriously the mandate to stay at home, to social distance. If you're outside now, the recommendations really are to be wearing a mask, as much to protect other people from you who could be a silent carrier than to receive it yourself. So with that, I'm going to end, and I want to thank everybody for plugging in here today. We'd encourage people, if you would like, we would like to continue this, to be in touch with you as long as we're in the present situation of stay at home, to maintain contact, to maintain confidence among people, to maintain our hope in a God who has not abandoned us, and a God who gives us the intelligence as human beings to be able to do our part to hasten the length of this disease so that we can overcome it and return to a sense of normalcy. I'd end by saying that we end with great gratitude to all of you who really are walking with us in this journey. We offer you Godspeed. You're in our thoughts and prayers, and we ask that you keep us in yours. And please do be in touch. You can go to our webpage. If this means anything to you, you can provide your name and your phone number, your email address, and we will put you on a link that gets you involved in what we're doing. If you have suggestions about how this YouTube interaction can help you, if it is beneficial to you, let us know. And let us know if there are things you might be asking of us that we can do for you but through this mechanism. We would be very interested in knowing that, because we would like to maintain touch and hope that very soon we can all be together again with our workshops, our community meetings, our English for speakers of other languages, and our email that goes out to you twice a week, really offering spirituality advice as well as social justice issues, bringing to the forefront issues that are affecting all people in this country and likely throughout the world. So until we can meet again, may God be with you, may God bless you, and know fully that you are in our thoughts and prayers. We ask yours. So until we see you again, be well. Thank you.